Hello everyone. I am Dr. Mugdha Raut. I am a practicing gynecologist, obstetrician, and a clinical reproductive immunologist. We have centers. Dr. Raut's Center for Reproductive Immunology in Mumbai and many other places in India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our patented process of lymphocyte immunization therapy or Immulat and other immunomodulatory treatments. Today, I am going to talk about a little different topic, that is, why LIT at Dr. Raut's Center for Reproductive Immunology. Many patients and our doctor friends ask us, where should we take LIT treatment? And how do we select a center to get proper LIT done? As you know, LIT is an active immunomodulatory treatment beneficial in cases of so-called unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility. So, what are the important factors that affect the success of the LIT procedure? There are 5 factors. The first one is proper selection of patients with the help of immunological tests. Second is a correct technique of the LIT procedure. Third is a right qualification of doctors, that is clinical reproductive immunologists. The fourth is the right laboratory setup. And lastly, proper clinical follow-up. Now, let us discuss each factor separately. The first one is proper selection of patients. This is the most important. There are immunological tests that help us to select couples who will be benefited by LIT. And only these couples should be given LIT. If it is given to all the couples with reproductive failure, the procedure will not give good results. The second factor is the correct technique of the LIT procedure. LIT involves careful collection of blood without damaging the cells, proper separation of lymphocytes, and injecting these cells in the most appropriate manner to achieve the best immunological response. A continuous process of innovation is important to ensure improving success rate. And for the above 2 factors, that is proper selection and correct technique, the third factor becomes very important. And that is the qualification of the doctor who is doing the LIT procedure. Qualified clinical reproductive immunologists are well versed with these techniques and they can ensure that the proper selection and innovation technique is followed in the center. Now, to actually do the LIT procedure, it is important to have the right lab setup with all precautions. Use of the correct equipment and reagents is essential. This can then translate into better results. And lastly, a proper follow-up of the couples who have undergone LIT treatment is important. Here, the clinical experience of the doctor performing the LIT procedure is very important. The right individualized protocol of the immunomodulatory medicines is very important. This is given after the LIT procedure when the patient is planning conception. We have seen that many times when these patients take fertility treatment after LIT, they do not get the correct immunomodulatory medications. Sometimes the doctors are not aware how to administer these medications. At these times, it is important that they are guided and supported by the LIT center to ensure the best results. At Dr. Raut's Center for Reproductive Immunology, there are qualified clinical reproductive immunologists with more than 30 years of experience. They have been working in the field of reproductive immunology for more than 30 years. They have presented their work in various international and national conferences and have even written a book on the subject of LIT titled Lymphocyte Immunization Therapy LIT in Reproductive Failures, New Horizon, published by the prestigious Springer publication. The LIT procedures of Dr. Raut's Center for Reproductive Immunology are associated with a success rate of around 80%, which is similar to that seen in various international studies. So, in conclusion, for best results of LIT procedure, there should be proper selection of patients, the right technique should be followed, it should be done by experienced and qualified doctors at well-equipped centers, and there should be a proper follow-up. If these factors are present, that LIT center can ensure excellent success of the LIT procedure. Thank you.